It is day 3 of the coronavirus vaccine distribution here in the United States. Hundreds more hospitals are getting their first shipments today of Pfizer's coronavirus vaccine, and thousands more frontline healthcare workers are finally getting their first dose of protection after facing this deadly virus head-on for 10 months. Many healthcare workers have fallen ill themselves or lost colleagues and friends and loved ones. The vaccine remains a sign of hope. 20 million Americans are expected to be vaccinated by the end of this year, with the possibility that another vaccine, this one from Moderna, could be available by Monday, pending likely approval by the FDA by the end of this week. Joining our conversation, Dr. Peter Hotez, founding dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Hotez got his COVID vaccination yesterday. I should just say, in the interest of disclosure, you were supposed to be with us yesterday, but you had to move that interview to today because you were getting your vaccine. Just talk about what it's like to work in this space, to have been one of the most forceful and informed voices to the American public over the last 10 months, and then to be protected from the very thing we've been talking about yourself.
Yeah, Nicole, it was a whole range of emotions and very intense emotions at that. Well, first of all, there was curiosity because we're developing a COVID-19 vaccine that's being scaled up for production in India and tested across India, a different type of vaccine, a low-cost vaccine for global health. So here I was getting a different COVID-19 vaccine. That was interesting. I think for me, though, it was a bittersweet moment. Yes, I was happy to be vaccinated and knowing that there's now a very low likelihood after I get the second dose that I won't wind up in an intensive care unit or a hospital as a patient. So I was gratified about that and grateful, of course, to Pfizer and BioNTech and the NIH and Operation Warp Speed and the FDA, of course. But then there was also this profound sadness of the 300,000 Americans who have already lost their lives, knowing that if we had this vaccine earlier, we could have saved their lives, or knowing that if we had a national program for COVID-19 containment, we did not have to approach anything like 300,000 lives lost. Yes, maybe some were inevitable in that first wave, but all of the people who lost their lives over the summer in the southern states or in the Midwest now in September, October, nobody, we didn't have to lose those lives. And I kept thinking to myself, what if I had, pushed harder or been more vocal and try to get people to understand about social distancing and contact tracing and wearing masks. But, we just could not overcome that massive disinformation campaign that came out of the White House over the summer that downplayed it and said it was a hoax or attributed deaths to other causes or these fake concepts of herd immunity and discrediting masks. And so there was a combination of anger and profound sadness of lives lost that we could have gotten them through to the other side and gotten them vaccinated like I got my vaccine last night.
Well, and it would appear that everything you just described is still very much an apt description of America's fight with coronavirus today. The thing that's changed is we have an incoming president in President-elect Biden and Vice President-elect Harris who are going to work to protect us from it. I mean, it's been unclear at any point if Donald Trump was interested in that, in gathering his people in maskless rallies, in getting sick himself and spreading it to Chris Christie. And I mean, you could go on and on with all the mixed signals that he sent to his millions of supporters. But I wonder how that translates to how people are receiving the news of the vaccine and what you think of the polls about people's willingness to take it.
Yeah, there was a very interesting poll that was just completed by the Kaiser Family Foundation. Let me just say this about polls. I think, there's so much in the 24-hour news cycle that I think the poll may have somewhat reflect the day that the poll was given, because, if they had done it on a day when there were the 2 allergic reactions in the UK, that might have given you a different result. But 2 clear trends emerged. One of them is a very high rate of vaccine hesitancy or refusal among Republicans. And I think they were more in 30 to 40-year-old age group, so 42% and then among the African American community. And the Biden team's going to have a tough time reaching across the aisle, and especially in the red states. I mean, let's face it, this summer and fall, this was primarily overwhelmingly a red state disease. And that's why I've been really reaching out to conservative news outlets to save as many lives as I can in the last few months.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.